Here we'll learn basics of the brainstem, cerebellum, and cranial nerves. Start at table. Begin with the brainstem. Let's start with brainstem axial sections. Establish the posterior anterior rotational plane of these sections. First, draw the midbrain. We'll pay special attention to the cerebral peduncles, periaqueductal gray area, red nucleus, and substantia nigra. First, posteriorly draw the periaqueductal gray area, which surrounds the cerebral aqueduct of Sylvius. It's a key site of opioid action for nociception, pain modulation. Then anteriorly draw the cerebral peduncles, also known as crus cerebri. In radiographic view, the way in which we look at the midbrain clinically, the cerebral peduncles will be at the top. The cerebral peduncles carry the motor tracts, the corticonuclear tracts, also known as corticobulbar tracts, medially, and the corticospinal tracts laterally. The anterior localization of the cerebral peduncles helps us remember that throughout the brainstem, motor tracts localize anteriorly. Then draw the bilateral, thinly shaped substantia nigra, which are essential for motor activation and are degenerated in Parkinson's disease. Then the bilateral circular-shaped red nuclei. They provide upper extremity flexion movements, which are observed in decorticate posturing, a sign of central nervous system injury. Next, draw the pons. We'll pay special attention to the pontocerebellar fibers and the pontine nuclei. Draw representative pontine nuclei within the anterior pons. They receive input from cerebral cortical neurons. Show that the pontine nuclei project pontocerebellar fibers into the middle cerebellar peduncle as an important step in the corticopontocerebellar pathway, which modulates movement. As a clinical correlation, widespread injury to the anterior pons causes locked-in syndrome. Now draw the medulla. We'll pay special attention to the medullary pyramids and the inferior olive. Cap off its most anterior region with the medullary pyramids, the medullary correlate of the cerebral peduncles. They carry the descending corticospinal tract fibers which decussate at the cervical medullary junction. Now draw the inferior olive just behind the medullary pyramids. The inferior olive contains climbing fibers which project to the contralateral cerebellum as part of the clinically important triangle of Guillain-Barré. Now let's show these structures in inferior view. Establish the superior-inferior orientational plane. Show that the cerebral peduncles in the midbrain resemble Mickey Mouse ears. Draw the ovoid-shaped pons. It has a large basis, like a bag of motor neuron marbles. Next, draw the medulla as a narrow column and indicate that it's an extension of the spinal cord. Lastly, show the leafy hemispheres of the cerebellum. Let's now introduce the three modules of the cerebellum to get a quick understanding of its clinical functional anatomy. To note that they're the vestibulocerebellum, the oldest portion of the cerebellum, which comprises midline vestibulo and olivocerebellar fibers that are important for equilibrium and eye movements. The spinocerebellum, which developed after the vestibulocerebellum, it receives the spinocerebellar tracts and plays a major role in postural stability. And the pontocerebellum, which is the newest portion, it acts through the corticopontocerebellar pathway for fine motor movements. Now let's introduce the cranial nerves. In our table, let's write them out from top to bottom. Ultimately, we'll organize them into their embryological sets when we draw a diagram, which will provide an intuitive way to remember them. But first, let's use the oft-quoted mnemonic, "On old Olympus's towering top, a Finn and German viewed some hops." This stands for, from superior to inferior, cranial nerve 1, olfactory, on, cranial nerve 2, optic, old, cranial nerve 3, oculomotor, Olympus, cranial nerve 4, trochlear, towering, cranial nerve 5, trigeminal, tops, cranial nerve 6, abducens, A, cranial nerve 7, facial, fin, cranial nerve 8, auditory or vestibular, and this is also known as the vestibulocochlear nerve, 9, glossopharyngeal, German, 10, vagus, viewed, 11, spinal accessory, some, and finally 12, hypoglossal, hops. First, show that cranial nerve 3, the oculomotor nerve of the oculomotor complex, exits the midbrain near midline. It innervates several ocular muscles, which we list in our notes. They rotate the eye inward, downward, and upward, and produce pupillary constriction and eyelid elevation. Show that cranial nerve 4, the trochlear nerve, wraps around the outside of the pons. It originates from midline in the lower midbrain. Importantly, cranial nerve 4 decussates. It crosses midline as it exits the brainstem contralateral on the side opposite to its side of origin. It's the only cranial nerve to make this decussation. It innervates the superior oblique, which produces eye intorsion and depression. Cranial nerve 6, the abducens nerve, exits near midline from the pontomedullary junction. It innervates the lateral rectus, which rotates the eye outward. Now show that cranial nerve 12, the hypoglossal nerve, emerges paracentrally from the mid-medullary level. Just like cranial nerves 3 and 6, cranial nerve 12 has a central midline course. It provides tongue protrusion. All of the actions addressed so far involve midline musculature. Next, beneath the medulla, show that cranial nerve 11, the spinal accessory nerve, emerges laterally from the cervical spinal cord. It provides head turn and shoulder shrug. So now group cranial nerves 3, 4, 6, 12, and 11 as the somatomotor set. As we've just learned, the thing that ties them all together is that they all innervate midline musculature, and they all tend to originate from midline lying nuclei. For the next set of cranial nerves, draw cranial nerve 2, the optic chiasm. It lies superior to the midbrain. It's the bundle of crossing fibers of the optic nerve as it transitions to the optic tract. It's dedicated to vision. Next, along the upper lateral medulla, draw cranial nerve 8, the vestibulocochlear nerve, which carries hearing, auditory, and balance vestibular, two separate sensory functions. Finally, we can't draw cranial nerve 1 into this diagram, but it's the olfactory nerve. It's the short course of olfactory wiring from the olfactory epithelial surface to the olfactory bulb. Group these cranial nerves as the solely special sensory set, cranial nerves 1, 2, and 8. The thing that ties them together is they purely serve sensory function. Finally, denote the last cranial nerve set, the pharyngeal arch set, which by process of elimination comprises which cranial nerves? 5, 7, 9, and 10. These nerves all contain numerous functions, which will make them the most difficult to learn. Here simply indicate that beneath cranial nerve 4 is cranial nerve 5, the trigeminal nerve. It provides motor function for mastication and receives facial sensation. The thickness of the cranial nerve 5 sensory division reflects the exquisite sensitivity of facial sensation. Above cranial nerve 8, draw cranial nerve 7, the facial nerve. It most notably provides facial movement as well as taste sensation from the anterior two-thirds of the tongue. Facial palsy is a flattening of one side of the face, and it's a common presenting neurological complaint. Beneath cranial nerve 8, draw cranial nerve 9, the glossopharyngeal nerve, and below it, draw cranial nerve 10, the vagus nerve. It's easiest to learn them together because their actions are similar and most easily remembered when they're grouped. They carry key autonomic functions, including swallow and cardiopulmonary functions. Notably, cranial nerve 9 is involved in salivation, and cranial nerve 10 is involved in gut motility. This concludes our diagram.